The decisions you make about Medicare in the first year will affect your health and finances for the rest of your life. I've been through this book 3 times now. I started it about 9 months ago, and all I can say is Medicare is a mess. This free Medicare guide is a useful tool as well. And as opposed to a library book, you can mark it up. Frankly, I never thought I would live long enough to get Medicare. But my general impression was that it was an inexpensive and comprehensive source of medical care for older people. I thought Medicare was free, or maybe you paid $20 when you saw a doctor, and everything was covered. Boy, was I wrong. Instead, I found a confusing patchwork of inconsistent and incomplete coverage that appears to be designed in response to the healthcare industry instead of trying to provide comprehensive care to older people. The insurance industry spent close to $160 million lobbying last year. I spent $0. Who do you think Congress listens to when it writes the Medicare laws? And the biggest spender on lobbying is the pharmaceutical industry, which spent more than double that of the insurance industry at $373 million. Maybe that's why Part D drug coverage is the most disastrous part of the Medicare mess. Let me clarify that I am an ordinary Joe. I have no particular expertise in this area, and there are plenty of YouTube videos about Medicare. But the overwhelming majority are by insurance brokers who make their living selling you policies. That doesn't mean the information they provide is wrong, but they do lack the perspective of someone who's seeking to understand this confusing program for himself. And that's me. I don't receive anything from anyone for making this video. Medicare Advantage programs pay brokers a maximum fee of $611 for new contracts and $306 for renewals. Medigap policies pay a variable non-cap percentage of the premium, which averages 20% for a new plan and 10% on renewals, or about $309 on a $129 a month Medigap policy. It looks like brokers have almost double the incentive to recommend an Advantage plan. And there are other sources of misinformation. Fidelity issued a shocking figure on the average lifetime uncovered costs under Medicare. Here's an example from Kiplinger magazine. But when you go to the source, it turns out they included only A, B, and D, but not Medigap, which left a large uncovered area of healthcare costs. They want to scare you and get you to keep money at their brokerage. Understand the motivations of people providing you advice and be especially careful of those making money on the information they provide. Now, every state does have a federally funded State Health Insurance Assistance Program, SHIP. I contacted mine, but found the information they provided less comprehensive than what I found in the books and materials I have read. They did gently confirm my choices are good ones, but I personally would not rely on them as a primary source of information. I believe I've learned enough to make an educated decision about Medicare for myself, and in this video, I'll share what I've learned, but please think of me only as a neighbor you visit to see what he's learned. You're going to need to figure this out for yourself. Unfortunately, I imagine that a number of people make choices not based on an understanding of the Medicare program, but on what friends or relatives have done, or worse yet, based on the advertisements of celebrities like Jimmy Walker, Joe Namath, or William Shatner. The insurance companies pay these spokespeople millions of dollars because their ads work. In fact, the ads have been so misleading that starting September 30th, 2023, they will need to clarify that they are pitching for an insurance company, as well as some other restrictions. Also, some people, it seems, have a degree of denial when they make their Medicare selections. They say, I'm in good health now, so I'll go with the cheapest plan. A doctor's just a doctor, and any doctor will do. To me, that's short-sighted. There is a 100% chance that your body will fail and you will die. Heart disease, cancer, COVID, accidents, and stroke are leading causes of death in the US, and none is inexpensive to treat. I encourage you to face the reality that your body will deteriorate and you will most likely need expensive medical care at some point in your life. Now, here's my personal situation. I was diagnosed with cancer a few years back, and I've hit the out-of-pocket maximum on my insurance plan more than once. The term gains real meaning when you've paid it. I've been forced to negotiate for a surgeon outside of a practice group, and I've sat for 3 hours in a chemo infusion chair while I waited for the insurance company to authorize the pharmacist to mix the chemicals. I'm not in denial. I know I will die, and I know I have a very high chance of needing expensive medical care. That's why it's so important for me to understand Medicare, and my personal situation impacts my choice of plans. What I'm going to describe here is the basic pattern of Medicare, and there are exceptions to every rule. This is a complex mess, and it would be a full-time job to understand or describe it completely. There are two basic choices for receiving Medicare. The first is Medicare Advantage, also called Part C, which I will call Advantage here. The second is Original Medicare with a Medigap supplement, which I will call Original here. Medicare coverage is not comprehensive, especially when it comes to medications. All Medicare systems have gaps, and those gaps can be expensive. The simplest and preliminarily most attractive Medicare program is Advantage. If this square represents your medical needs, Advantage provides a one-stop shop with some notable holes in coverage. Advantage has become increasingly popular over the years, to the extent that this year, 2023, it's become the most popular Medicare program, with 51% of almost 66 million Medicare enrollees participating. First, contrary to what many people say, Medicare Advantage is not free. Both Original and Advantage enrollees must pay a Part B premium, which is $164.90 in 2023 and $174.80 in 2024. I'm just going to say $165 and $175. Maybe because the Part B premium can be automatically deducted from your Social Security payment, people forget they're paying it. But for someone like me who's not yet collecting Social Security, I'm going to need to actively make this payment. Now, about 75% of Medicare Advantage plans have no additional fee beyond the Part B premium. Plus, many provide benefits you don't get with Original Medicare, like dental coverage, gym membership, and eyeglasses. How do they do it? Well, the government pays them approximately $12,500 a year for your medical care costs, and then they give the Medicare Advantage plan a bonus of about $2,350, which they can use to pay for the additional benefits. But there is trouble in paradise. First, Advantage plans are all managed care plans, essentially HMOs, although they use various terms to describe themselves. This means you have a limited number of doctors you can see, and you have a gatekeeper who determines if you can get the care you desire. Effectively, that limits the doctors you see to one geographic area, and you need to get permission to see that doctor. That's one of the ways they make money, by limiting the care you get. Next, there are numerous fees. When I was young and we had junk cars, we used to use the expression, "That car will nickel and dime you to death." That's an apt description of Medicare Advantage, except it's not nickels and dimes anymore. Every time you see a doctor, there is a fee. Every time you see a specialist, there is a fee. If you go to the hospital, there is a fee. If you get a CAT scan, there is a fee. And if you have a major medical problem, these fees add up. Advantage plans have an out-of-pocket maximum. For example, The United Healthcare Advantage plan in my area has a total out-of-pocket maximum of $8,900 and an in-network out-of-pocket maximum of $4,300. The national average is $8,659 for out-of-network and $4,835 for in-network. And believe me, I've had a major health issue, and you can be hitting these out-of-pocket maximums in a matter of weeks. After that, Advantage pays for all of your care with some exceptions. And not to confuse things too early, but the Part D deductibles do not count towards your regular Advantage out-of-pocket maximum. The good news is that Advantage plans do not exclude pre-existing conditions, and you can switch to a different plan every year. The bad news is that the participating doctors and coverage can change at any time, and they can raise the price. There are no price controls. It's what the market will bear. Medicare Advantage may be the best plan for some people. It's simple, it's less expensive, and it can meet all the healthcare needs of someone with minimal health issues. It requires only one payment, which can be taken automatically out of your Social Security check. Statistically, Advantage enrollees tend to be less well off and less educated than original Medicare enrollees. But Medicare Advantage has far more complaints than original Medicare. And an analyzing nonprofit found in 2019 that with all things considered, it cost enrollees $321 more per year to be in Advantage compared with original. A final analogy about Advantage: it's kind of like dating a person with lots of nice jewelry. She's fun to be with, but if you come down with cancer, she's just not going to be there for you the way the original plan would. The alternate plan is original Medicare, which is composed of Part A, which is free, Part B, for which you pay a fee, Part D drug coverage, for which you pay a fee, and usually Medigap, for which you pay a fee. And the bad news is that you have to pay each of the three fees separately. Plus, you have to take time to shop around for your Medigap and Part D plans. What a Medigap policy covers is set by the government, and the policies are given letters A through N. Why not give them numbers? So, for example, you don't confuse a Medigap policy C with a Medicare Part C plan? Well, that's part of the Medicare mess. I will not discuss the various lettered plans, but only focus on the most popular and comprehensive plan, Plan G. Now, here is the shocking thing I learned that I don't think is emphasized enough. Outside of an initial enrollment period, Medigap insurers can exclude pre-existing conditions. That's right, if you have asthma, cancer, diabetes, they can refuse to issue a policy to you after the initial enrollment period. You can switch Medigap providers without any exclusions during the first 6 months of Medicare enrollment, or once in the first year if you chose Advantage and then switched back to original. But that's it. This rule is modified in 12 states, and it's up to you to check the rules where you live. But for everyone in the remaining states, you have 1 year or less to get into a Medigap policy, or you could be excluded for life. This rule applies only to Medigap, and you can always move over to Advantage without worrying about pre-existing conditions. Now, original Medicare with Medigap and Part D, which I will just call original from now on, does cost more. For me, an AARP United Healthcare Plan G, the most popular plan and the most popular carrier nationwide, costs $129 in 2023. Plus, a low-fee Part D plan, and more on this later, costs about $10 for a total monthly cost of $139 more than an Advantage plan. But there are distinct differences in fees and coverage. First, fees. In original with Medigap, you have to pay the first $226 of your doctor bills. Then 100% of your doctor and hospital care is covered. That's it. No copays when you visit the doctor, no $300 fees for CAT scans. It's covered. Second, and most importantly to me, you can see any doctor who accepts Medicare anywhere in the United States. Plus, you don't need to ask anyone's permission to see any doctor. For example, if you have a rare condition and find a specialist in Minneapolis, you can go there without asking anyone's permission. And once your $226 Part B deductible is paid, it's free. Having switched both surgeons and oncologists during cancer treatment, this flexibility is essential to me. To me, this is the most important benefit of Original Medicare. The second major benefit of Original is that if you need expensive medical care, it can be less expensive than paying the various fees and out-of-pocket maximums of Advantage. But once again, Original Medicare is a mess. First, there are no restrictions on the fees Medigap providers charge. They can change yearly as the market will bear. Companies can leave states at will. You do gain some rights to get another Medigap provider if this happens, but essentially the open market prevails. Second, and this is an element that's not often discussed, seemingly just to make things more complex, there are 3 patterns by which Medigap providers can treat age in setting your premiums. The first is called community-rated, no age-rated, or level premiums. And that's the best option. There's no change in rates by age, but premiums still go up as costs go up. The second is issue age, sometimes called entry age rated. Their premiums remain the same as for someone the age you were when you bought into the plan. Basically, the premiums are frozen at the age at which you bought into the plan. And the final one, and least advantageous, is called attained age. The premiums increase as you age. So if you go and you shop for a Medigap policy, be sure to check how you are charged within that insurance policy by age. Because you essentially get locked into your Medigap provider, you need to understand and select the most advantageous pricing strategy when you first sign up. Finally, the biggest disaster within the Medicare mess is Part D drug coverage. For what it was designed, I don't know, but from my perspective, it was not designed to give reduced drug price coverage to older Americans. I will not claim to even be able to talk intelligently about Part D coverage, but only to say how it applies to me. I'm lucky to take only one drug currently, Montelukast sodium, which is generic Singulair, which has a retail price of $8.10 for a month's supply at Costco. I can sign up for a Part D plan for $8.80 a month, then pay an additional $2 a month to get a drug that retails for $8.10 a month. And the government pays the insurance company $2,000 a year to provide me with this service. Ugh. Now the kicker is many drugs are not covered. I had cancer and took an oral medication that cost me $3,000 for each 2-week course over a 4-month period. Oral cancer drugs are simply not covered by Part D, not in Original and not in Advantage, not at all. I will be 100% responsible for my oral cancer medication payment if I get a recurrence. Now, isn't that a kick in the teeth? You can see why I say Medicare is a mess. And I'm not alone in this. This Kaiser Family Foundation article took a look at uncovered costs for common cancer drugs in 2019, and those costs range from $8,000 to $16,000 annually. Those costs would be higher today. About 10% of Medicare enrollees purchase no drug coverage at all. But there is another kicker. The government penalizes you if you do not initially enroll in Part D and then later sign up. You're penalized by an amount equal to 1% for each month you did not enroll, times the average national base premium, I'm not making this up, of $32.74 for 2023. You then have to add that amount to the premium you would pay if you later enroll in Part D. Some improvements to Part D are on the horizon, so my decision is to enroll in a low-cost Part D program so I don't have to pay the penalty in case the program is later made functional. To me, Part D is like trying to cover your medication needs with a piece of Scotch tape. It's completely inadequate. But because of the penalties and the promises of improvements, it's a necessary evil. And medications are not the only thing left uncovered. For example, 70% of older people will need long-term care, for example, living in a nursing home. But ordinary long-term care is completely outside of Medicare. There is no coverage. I've struggled for an analogy to describe the relationship of Advantage to Original. I thought of marriage, I thought of cars, but no analogy fits this mess. The best one I came up with is houses. Advantage is like a new house in a gated community. It has lots of nice features like a covered porch with a stainless steel grill, a hot tub, and a putting green. The house is initially cheap, but the gated community has a lot of fees. So every month you pay for the guard at the gate and for access to the clubhouse. Once you move in, you can only see doctors who live in that community, and you have to ask the homeowners committee for permission to see the doctors. Once you move into the gated community, you can move to another house or plan, but like Hotel California, once you move in, you can never leave if you have any pre-existing condition, which would be the likely reason if you're looking to move out of your Advantage plan. Original is also like a house, but one you have to live in for life. It does not have the features of an Advantage home, and it costs a little bit more initially, but once you buy it, the overall costs are lower. There's no fee for the guard at the gate, and there's no fee at the clubhouse. In fact, there is no gate and there is no clubhouse. But unlike in the Advantage gated community, you can see whatever doctor you like anywhere in the country, and the fees are less. However, you have to choose your house carefully because you're likely going to stay there for the rest of your life. Now, granted, it's a forced and partial analogy, but I hope it describes some of the differences between Advantage and Original Medicare. As you've already deduced, my choice is to go with Original Medicare. It will only cost me $139 a month more than Advantage, and the benefit of being able to see any doctor anywhere in the country is worth it to me, since I faced having to change doctors for life-saving treatments in the past. Also, I'm unwilling to gamble that my medical needs will be lower as best fits an Advantage plan. I'm willing to bet my needs will be higher, so I choose to go with the one that will cost less over time. Now, of course, the final forget you from Medicare is this. For most workers, healthcare coverage was a non-taxed work benefit. However, Medicare fees are paid for the most part with after-tax dollars. So if you pay the average tax rate of about 25% on your earnings, you'll need to earn $1.25 before taxes to pay every dollar of your Medicare costs. So hopefully this explains why I see Medicare as a mess. The partial is coverage, the rules are complex, but for me, it's the only game in town, and I need medical care. Once again, if you're not yet 65, please understand that the decisions you make about Medicare in your first year will affect your health and your finances for the rest of your life. My recommendation is that you start looking at Medicare issues a year before you qualify. This will give you time to read books, watch videos, and talk with your relatives, friends, and neighbors to understand their Medicare choices. I reached my initial conclusion right after my 64th birthday, but I've just reanalyzed everything to see if an Advantage trial was worth a try. In the final analysis, considering my health issues and my desire to control my own health care, it's not. What Medicare plan you choose is up to you. I only hope that you will make an educated choice that provides the best health care available from this messy program.